When your pet comes home, one of the things that you can do to help improve comfort and reduce swelling to the surgical site is to do cold therapy. I provide you with a compress that can be used for both cold and for heat. We have two special sizes and I will decide what works best for your pet's surgical needs. When applying a cold compress to your pet's incision, make sure that you put this in your freezer for at least 1 to 2 hours. When you take it out of your freezer, before applying to the surface of the surgical area, you want to wrap it with a light towel to make sure that the plastic is not directly on the skin. That will probably prevent your dog from resisting the ice therapy. While we find that icing is very helpful to reduce pain and swelling, what's not helpful is if your pet gets very stressed while you're applying this. So if it's not working, don't stress, move on, and we can try again another day. It sometimes can be helpful to distract with treats or have somebody pet and entertain your dog while applying. So if you can phone a friend or get some help with your family, you might have more success. Once you wrap in a towel, depending on the size and the location of the surgery, you can either wrap this around a leg or apply it to the area on the body. And typically the cold is going to hold its temperature for about 15 minutes. I recommend doing 15-minute sessions about 4 times a day if you're able to do so. And typically after about 72 hours of surgery, I have you switch to doing warm therapy. At that point, you're gonna place this in the microwave for 30 seconds and then feel and make sure that the temperature is warm to the touch. If it's not warm enough, then go ahead and put it back in the microwave for another 10 to 20 seconds until it's warm to the touch. You do not want to apply this to the skin when it's hot because we do not want to induce any kind of burns. Don't worry, it's very safe if you only do warm to the touch and you wrap it with a towel before applying it to the surgical area. Typically, the heat's going to be maintained in this compress for probably about 10 to 15 minutes. So as long as this is warm, you can keep it on your pet. I would recommend, as animals can chew, even though this is a non-toxic material, I think when the company describes this, they're not thinking about it being eaten. So we want to make sure that we're not just leaving our pet unsupervised while we're applying the cold or warm therapy. If at any point there's compromise to the packaging, please throw these away. And I do want you to just take some gentle soap and warm water between each application just to make sure that what you're applying even close to the surgical site is clean. Most pets really love the warm compress. You can't really overdo it, but I would suggest the same kind of scheme, about 15 minutes, 4 times a day until all the swelling has resolved.